Government has made a lot of investment in the two schools. You can see it with your own eyes. A lot has been done. School of Nursing Katsina is now 61 years old because it was established in 1956, exactly 61 years ago. But I have been in the school for over 30 years. Honestly, I'm not bragging, I'm not boasting. There is no government that has come to our aid to see that the schools has reached the level it has reached now.
Over the decades of the existence of the school, successive governments have come and gone with their reform to reshape the school and restore its glory, a decision that led to the relocation of the College of Midwifery to Malumfashi in 2007. But the lingering reforms seem not to have achieved much until now that much commitments are being made to achieve more of the objectives of establishing the colleges.
We moved here permanently 2007. As of 2007, we only have 3 midwife tutors. But when you look today, we have 16 midwife tutors. And that is to the help of the state government that have given chances for recruiting of midwife tutors at any point in time, if we should have any.
There has never been a time when we have seen a lot of projects by any of the government in the state like this time around. Many things were done and in a very short time.
The unsuccessful attempts by the colleges to attain permanent accreditation in the past for not meeting off with National Nursing Council requirements due to inadequate staff and unconducive teaching and learning atmosphere seriously affected the output of the colleges, a situation that set the path of the objectives of the colleges backward.
We've never had full accreditation. Yes, this school has been in existence for 60 years, but only 50 students were being indexed per admission. Every session we take only 50 students. This was also very unfortunate because even for human beings, after 60 years, someone is very old and getting ready to retire. So we looked at it critically. What is the problem? That means in the long term, unless we address the problems of our health training institutions, we wouldn't even have any healthcare worker to recruit. We wouldn't have any nurses in particular in this case, because the schools will be shut down. The School of Midwifery, when I came on board, I was made to understand that the Nursing and Midwifery Council had written a letter to them that the next time they present students for the final exams, if at least 50% did not pass, the school would be closed.
Over the years, most of the buildings were at the verge of collapsing, while the school environment looking unkept and the students' hostel, staff quarters, as well as the class areas are dilapidated, a situation that subjected the students to a trauma.
The school environment, before now, there are so many water lodge areas where we have, if it is rainy season, if you come here, it is just like a dome. Everywhere you see is water. So government has landscaped everywhere now. Our school auditorium, which was dilapidated seriously, and now is best in the whole country.
If you look at the past, the school environment looked like a hostile environment to the student. We that study here, we actually find the place so difficult to comprehend what our teachers are teaching us. But now, everybody who come into the School of Nursing knows that change has taken place.
Before we are managing, because the environment there was not so much conducive, because even if you consider the classrooms, You may come to the class, you will see it, the windows, the glasses were broken. So during winter or rainy season, we experience some hardships to cope with the situation. Then if you go to the hostels, there are also, during rainy seasons, sometimes we are experiencing a lot of problems, but now the problems have now been solved.
The School of Nursing is the first school of nursing owned by the government in the northern Nigeria. And since then, the school has been trying or struggling to be accredited, that is, to admit at least 100 students. But unfortunately, before, this wasn't possible. Fortunately, with the emerge of this current government, the accreditation has been done.
The situation was also the same at the College of Midwifery at Malamfashi, where students spend most of the class hours in search of water and the basic needs.
Our mission is to provide qualified and competent midwives. And then when you look at it, for a place when you lack electricity, you lack water, even the teaching learning process and the environment to be able to produce those competent, qualified nurses will be difficult. But giving us opportunities and providing us with this, I think it will give us a better chance of providing promising, competent, qualified and skillful midwives.